Kids under the age group of 5 years, they usually go through this kind of a syndrome, which is known as an attention deficit hyperactivity syndrome. The range of disorders, they are quite similar to any aggressive behavior, even that is usually seen in these kind of children. And then it is also sometimes related to another spectral disorder, which is known as an autistic spectrum disorder. So the symptomatology is quite similar in both of these syndromes. So it's again very important to clinically differentiate between these two kind of disorders. The age group that is usually involved in these ADHD, which is known as the attention deficit hyperactivity syndrome or disorder, that is usually the 5 years of age group or even older than that, they can be affected through this kind of a syndrome. The risk factors that are usually involved in the development of the ADHD again is the genetic. The genetics, they play a very important role in the causation of this kind of a syndrome, and then the environmental factors, the familial approach towards this kind of a disorder is again very important. If the behavior of the child is basically reinforced by the parents or the siblings, then this disorder can be very provoking for the child as well as the people around him or her. So one should know how to distinguish these children and how to go about and treat and manage these children. The awareness again is very important. That should be given to the parents and even to the general public towards this kind of an attention deficit hyperactivity syndrome. The IQ levels usually that are seen in these children, they can even be average or even above average. So the calculation of the IQ levels is again very important. The intellect usually is not affected by this kind of syndrome, but the behavioral disorders that are usually seen will be discussed over here in this section. Primarily, first of all, the definition that is related to this kind of a disorder will be discussed over here, and then the clinical features. The collateral history again is very important. You will basically investigate through the history which is taken by from the parents or the close relatives, and then the assessment of the child, whether he's suffering from a mild, moderate, or a severe variety of this attention deficit hyperactivity syndrome. That is again going to be assessed over here in detail. The key features that are usually involved in this kind of a syndrome are the hyperactivity that is seen in the child, and then the impulsivity and the inattention. So these are the terminologies that you should focus on. We should basically clinically assess the child. First of all, the physical features, the behavior of the child should be assessed as well. If he's inattentive or he's quite impulsive in his acts, in his or her acts, or hyperactive, these are the core features of a child who's suffering from such kind of a syndrome. According to the ICD-10 criteria, 1% to 2% of the population is suffering from this kind of a syndrome. According to the DSM-4 criteria, which is more of a generalized type, 3% to 9% of the young and 2% of the adult population even is suffering from this kind of a hyperactivity and inattention syndrome. Onset before the age of 6 is usually the time of onset that is seen in such children. The history taking again is very important. The parents would give you a history of the similar behavior before the age of 6 years. Mild cases do not require medication, and only counseling is enough for such children who are suffering from a milder form of ADHD. Moderate or severe cases, they require methylphenidate, psychoeducation, as well as the supportive therapy. So it's basically a conjoint therapy in which we are also giving the pharmacotherapy, as well as the counseling is done of the parents as well as the child. And then methylphenidate is the drug of choice that is given to such patients. The risk factors that are included are the birth defects, of course, and then the learning disabilities, and then the fetal alcohol syndrome, unknown genetic links. Attention deficit hyperactivity syndrome is basically more common in boys than in girls. This is the chart that is focusing on the causation of such attention deficit disorder. It can be an OCD, that is the obsessive compulsive disorder. Then the specific learning difficulties can also present in this particular attention deficit disorder. Then we have the autistic spectrum disorder, anxiety, Tourette's syndrome, OCD. Then we have the gifted children. Sometimes children with a higher IQ levels, they even suffer from this kind of a syndrome of hyperactivity and inattention. Auditory processing is one of the phenomena that can result in the attention deficit disorders. Sensory integration disorders, they can also cause such a disorder. Depression is one of the prevalent causes that can also clinically present as an attention deficit hyperactivity syndrome or disorder. Clinical features is basically a triad of impulsivity, hyperactivity, and poor concentration. So this is basically the clinical features that are observed over here. The secondary symptoms, they lack the lack of academic attainment or aggressiveness. So usually these children will have a normal IQ, but still there will be a lack of attainment of that particular academic achievements. Behavioral problems and poor peer relationships are seen in such individuals who are suffering from attention deficit disorders. The assessment that is usually done in such cases of the attention deficit hyperactivity syndromes over here will be discussed. The average age of attention deficit hyperactivity syndrome diagnosis is almost 7. Age when the symptoms of ADHD typically appear first is almost 3 to 6 years. So usually the average age of the diagnosis is 7 and the symptoms would usually appear before that age of onset. So this should be kept in mind. The symptoms would usually appear between 3 to 6 years of age group. 6.1% of the American children are being treated for the ADHD with medication. So it's again very important just to have a look at these facts and figures that this is basically quite an underrated condition. 42% increases in the ADHD, that is the attention deficit hyperactivity diagnosis, over the past 8 years. So there's an increase in the onset of this condition. There are multiple causes to the development of such a condition that should be kept in mind, ranging from the genetic abnormalities as well as the environment or the child has been exposed to, which is basically causing an increase in the incidence of such children who are suffering from the attention deficit hyperactivity disorders. The assessment that is going to encompass such attention deficit disorders is the reasonable length of time should be given for the diagnosis of such disorders in the children. The ADHD in the context of clinic as well as the school and the home. So one should be quite aware of the environment that is provided to the kid at school as well as at home when we are basically diagnosing these cases, because sometimes the children are not comfortable at school. Questionnaires to indicate the symptoms, but the diagnosis should be clinical. Questionnaires should be put forth to the parents as well as the patient if he or she is old enough to fill up those questionnaires. But the clinical diagnosis, the symptomatology, the triad of symptomatology should be observed in these children. So in this section, basically, we summarize this condition known as the attention deficit hyperactivity syndrome. How do we diagnose these cases and how do we go about to manage and assess these patients for a better outcome? So that is the end of this section. Thank you for watching sqadia.com.